short and simplified. So today we are going to deal on to a very important surgery question, that is principles of safe general surgery. So before moving on to safe general surgery, we need to understand a term known as primum non nocere. So what do you mean by this term primum non nocere? Primum non nocere means first do no harm to the patient. First do no harm. That is the meaning of this word primum non nocere. This is the philosophy of the surgical management. So primum non nocere is the philosophy Primum non nocere is the philosophy of the surgical management. So this is the caption we need to remember. A safe surgery always saves life. So as we saw this Latin phrase, that is primum non nocere, we are going to learn about the factors that are contributing the patient safety errors. So the factors contributing to patient safety errors, first we'll deal on with the human factors. Under human factors we have inadequate assessment of the patient, any error in the diagnosis, any delayed approach, improper interpretation of investigation. So say suppose the doctor is not correctly interpreting the investigation, then that also is a human, it will cause a patient safety error. So improper interpretation of investigations, and sometimes inadequate monitoring, overwork and fatigue. So these are the human factors, and sometimes the system can fail. So system failure can occur, and the reasons are inadequate staffs, poor communication, lack of coordination, poor infrastructure, poor governance, and cost. So these are the factors contributing to patient safety errors. Under human factors, we have inadequate assessment, error in diagnosis, delayed approach, improper interpretation of investigations, inadequate monitoring, overwork and fatigue. Under system failure, we have inadequate staffs, poor communication, lack of coordination, poor infrastructure, poor governance and cost issues. So there are certain strategies for the patient safety. So in order to assess the surgical safety, the patient safety, the WHO gives a surgical safety checklist. So what is this WHO surgical safety checklist? It comprises of three things. It comprises of many parameters which should be followed. The first one is sign in. The second is time out. And the third one is sign out. So what are these terms? Sign in means before induction of anesthesia. So before induction of anesthesia, checklist will be sign in. Sign in is checking all the parameters before the induction of the anesthesia. Time out means before skin incision. So before putting the skin incision, you are checking all the parameters before skin incisions. And sign out means before the patient leaves the operation theatre. So before patient leaving the OT, that is known as sign out. So there is WHO surgical safety checklist that has to be done in 3 conditions during 3 situations. Sign in, that is before induction of anesthesia. Time out, that is before the skin incisions. And sign out, which is before the patient leaving the operation theatre. And the next strategy for patient safety is very important, that is communication. So there must be a proper communication, that is a briefing before surgery and debriefing after surgery. So communication consists of briefing and debriefing. So briefing is before the surgery and debriefing is done after the surgery. The third strategy is a teamwork strategy. A proper teamwork must be there between the surgeons and the nurses. Teamwork strategy. Fourth is situational awareness. So there must be all the surgeons and nurses must be aware of the operation. They are going to do situational awareness. And the next strategy is adequate knowledge. Adequate knowledge must be there. Adequate knowledge of what? Of all the medications given, about the illness, about the procedure, and about the instruments. So an adequate knowledge on medications, illness, procedure, and instruments must be very apt. And the next strategy is a professional responsibility. So after professional responsibility should be there in relation to patient safety. The next strategy is identifying errors. So identifying errors is most crucial, and also rectifying them before any permanent damage can set in is very, very important. So the identifying errors can be any error, like a wrong patient or a wrong side or a wrong decision or a wrong surgery, wrong drug, or very importantly any retained mobs or swabs or instruments. So we need to check if there are any retained mobs or swabs or instruments. For this, to prevent this error, proper counting must be done of all the instruments, of all the swabs. So proper counting of all the instruments, swabs, gauges, and all should be written in the board clearly, and it's very, very crucial. So writing it in all the count, proper counting in a whiteboard clearly will solve this issue. Next is failures in operational techniques. So for any failure in operation technique can be done. So if there is any failure in the operation technique, like say because of cognitive errors of judgment, it can be the procedural, that is, say if the steps are not followed properly, and can be either executional or any misinterpretation, very important misinterpretation of any anatomy or pathology on the table, misuse of instruments like diathermy, or a missed iatrogenic injury. Next strategy is that involves is competence failure of a surgeon is a very, very important factor. So if at all the surgeon is not competent enough to do the surgery, then the patient safety will drastically be affected. So competence failure of a surgeon. And the last strategy for patient safety is a quality control. A quality control and audit. What is audit? To check all the accounts properly, or the organizational accounts and patient accounts. So a quality control and audit is a very, very important factor in imparting the safe surgery to patients. So in view, we finished the safe general surgery. So we need to remember the Latin phrase, which is primum non nocere. Primum non nocere means first do no harm. It's the philosophy of surgical management. We need to know the term that safe surgery is always going to save lives. So we studied about the factors contributing to patient safety errors like human factors, system failure, and at last we saw the strategies for patient safety like the WHO surgical safety checklist, sign in, time out, sign out, and how communication is an important strategy factor, teamwork strategy, situational awareness, adequate knowledge, professional responsibility, identifying errors, failure in operation technique, competence failure of surgeon, quality control and audit. So this is more than enough for this short note. So to learn more questions in surgery and in other subjects, stay tuned with this channel. Do click on the like button and subscribe button and be tuned. Thanks.